everyone, thanks so much for joining me today. My name is Lydia and this is Time with Lydia, the pharmacist. A warm welcome to you all. If you're new to this channel, this is a channel where we educate ourselves on common health problems. We provide advice and information on health and well-being, so please don't hesitate to hit on that subscribe button and also on the notification bell so you don't miss any of my videos. And to all our returning subscribers, a warm welcome to you all once again. I just want to say a big thank you to you for all the support. I really appreciate you. Today our topic is amlodipine, all you need to know. Amlodipine is a drug, and it's a drug that belongs to a group of drugs called calcium channel blockers. What is amlodipine used for? Amlodipine is used for the management of hypertension and angina. How does amlodipine work? Amlodipine helps high blood pressure by relaxing and widening blood vessels. This lowers your blood pressure and makes it easier for your heart to pump blood around your body. You can check out more information on high blood pressure on my video titled High Blood Pressure, All You Need to Know. And this will make it easier for you to understand how amlodipine works. With angina, you usually get chest pain because the arteries going to the heart valve become hardened and narrowed. Amlodipine helps by improving the blood and oxygen supply to the heart. This medication called amlodipine is only available on prescription, and it comes as tablets or a liquid that you swallow. Who can take amlodipine and who may not be able to take amlodipine? Most adults and children over 6 years can take amlodipine. Amlodipine is not suitable for everyone. To make sure it's safe for you, tell your doctor if you've ever had an allergic reaction to amlodipine or any other medicine. If you have a liver or kidney disease, if you've had heart failure or you've recently had a heart attack, amlodipine may not be suitable for you. What is the dosage and strength? Amlodipine comes as 5 mg and 10 mg tablets. The liquid comes as 2 different strengths, one with 5 mg amlodipine in 5 ml and one with 10 mg amlodipine in 5 ml. The usual starting dose of amlodipine is 5 mg once a day. If the starting dose is not working well enough, for example, your blood pressure does not get any lower or your angina is not controlled, your dose may need to be increased to 10 mg. To decide the correct dose for you in the longer term, your doctor will check your blood pressure to make sure it's not too high or too low. They'll also ask about any side effects you might be getting from the medicine. Doses may be lower for children. So how do you take amlodipine? You would usually take amlodipine once a day. You can take it at any time of the day, but try to make sure it's around the same time every day. You can take amlodipine tablets and liquid with or without food. Swallow amlodipine tablets whole and have a drink of water with both the tablet and the liquid. If it's easier, you can dissolve or disperse the tablet in a glass of water, but you must drink it all straight away if you do this. And here is something to take note of. Do not take amlodipine with grapefruit juice. Having large amounts of grapefruit or grapefruit juice can increase how much amlodipine is in your body and make side effects worse. If you are affected by this, you may have to avoid eating grapefruit or drinking grapefruit juice while taking amlodipine. Now, how long do you have to take amlodipine for? Usually, treatment with amlodipine is long-term, even for the rest of your life, because high blood pressure and angina can only be managed. They can't be treated. Talk to your doctor if you want to stop taking amlodipine. Stopping may cause your blood pressure to rise, and this may increase your risk of heart attack and stroke. If you're bothered by side effects, which might be the reason why you want to stop taking it, your doctor may be able to prescribe a different medicine for you. So now, what happens if you forget to take your medication? If you forget to take a dose of amlodipine, take it as soon as you remember that day and then carry on as normal. If you forget to take the dose for the whole day, skip the missed dose and take your dose the next day at the usual time. Never take 2 doses at once to make up for a forgotten one. If you forget doses often, it may help to set an alarm to remind you. You could also ask your pharmacist to advise on other ways to help you remember to take your medicine. What are the side effects of amlodipine? Like all medicines, amlodipine can cause side effects, although not everyone gets them. Side effects often improve as your body gets used to the medicine. These common side effects of amlodipine happen in more than 1 in 100 people. They are usually mild and only last for a short time. There are things you can do to help cope with them. Side effects of amlodipine include headaches, feeling dizzy, flashing, a pounding heartbeat, swollen ankles. Talk to your doctor or pharmacist if the advice on how to cope does not help and the side effects bother you or last for more than a few days. There can also be some severe side effects, but these side effects do occur in less than 1 in 10,000 people. Call your doctor immediately if you experience severe pains in your stomach with or without diarrhea, whether it has blood in or not. When you're feeling sick or you're being sick, that is nausea and vomiting. These can be severe side effects of amlodipine which need to be attended to immediately. Now let's talk about the effect of amlodipine on pregnancy, breastfeeding, and fertility. Amlodipine and pregnancy. Amlodipine can be used in pregnancy, although there is not a lot of information on its safety. It is not thought to be harmful to the baby. If you're pregnant or planning a pregnancy, talk to your doctor about it. They may wish to change amlodipine for a medicine that has more safety information. However, if your blood pressure levels are okay, then it may be better to continue taking amlodipine rather than switching to another medicine. Now, amlodipine and breastfeeding. If your doctor or health visitor says your baby is healthy, it's okay to take amlodipine while you're breastfeeding, but talk to your doctor or pharmacist as they may recommend a medicine we know more about, like nifedipine. Amlodipine passes into breast milk in small amounts and has been known to cause side effects in breastfed babies. If you notice that your baby is not feeding as well as usual, seems unusually sleepy, looks much paler than usual, or if you have any other concerns about your baby, then talk to your health visitor, your midwife, your pharmacist, or your doctor as soon as possible. Now, amlodipine and fertility. There's no evidence to suggest that taking amlodipine reduces fertility in women. Amlodipine may affect sperm function. Speak to your doctor if you are having difficulty trying for a baby, as stopping amlodipine may be considered. Talk to your fertility specialist if you're worried. Tell your doctor if you're trying to get pregnant, if you're pregnant, or if you're breastfeeding, as these need to be taken into consideration. In fact, not only amlodipine will be considered, but if you're on any other medication, those medications will be assessed to find out if they are suitable for you. I hope you have learned something new today. Please remember to give me a like, that is, give me a thumbs up, and don't forget to subscribe if you haven't yet subscribed to this channel. There's more interesting videos to come. And please remember to leave a comment in the comment section. Leave your questions as well, and I would answer them as soon as possible. Thank you so much for your time today, and I hope to see you soon in my next video. Bye for now.